With the crisis surrounding the healthcare sector in Kenya continues to deepen as more healthcare workers threaten to join striking colleagues to protest poor working conditions. This even as various counties begin to implement a raft of disciplinary measures against health workers who are on strike for quote-unquote absconding duty. The disciplinary measures include locking the medics out of their workstations and withholding pay. Check out this story produced by our very own Ben Kirui.
The county governments of Kisumu and Uasin Gishu have started implementing disciplinary measures against the healthcare workers who are on strike, straining an already rocky relationship with healthcare workers. The raft of measures instituted by Professor Anyang' Nyong'o's administration include stopping of salaries for 428 nurses currently on strike and ordering their respective supervisors to deny them access to their workstations. In a notice issued today, Chief Officer in the Kisumu Department of Health and Sanitation, Dr. Gregory Ganda, indicated that the striking nurses had been withdrawn from the payroll, vowing to recover December 2020 salaries, terming the payment as erroneous. The notice further gave the 428 nurses a 7-day ultimatum to show cause why disciplinary action should not be taken against them, failure to which they'll be sacked. In Uasin Gishu County, the administration has not only struck the names of striking medics off the payroll, but has also threatened to sack them if they do not resume work immediately.
Those staff that do not want to provide services, we are already taking action and we have said we will stop salary. And if it reaches a time that we need to advertise for those positions, we are going to do that.
The Uasin Gishu County Government has made a decision that the healthcare workers who are still on strike are not going to receive salaries. As the crisis deepens, more workers in the sector have joined the strike, threatening to paralyze operations in healthcare facilities. The Kenya National Union of Medical Laboratory Workers are the latest in line to demand better pay, medical insurance coverage, and better protective equipment, among a raft of grievances. And as if to add salt to injury, the hopes of white smoke in boardroom talks between the Kenya National Union of Nurses faded today after the anticipated meeting failed to materialize, as a result of which the ongoing strike continues.
The Kenya Medical Laboratory officers have been trained, and they are the only people with the mandate and skills to identify, to say, to declare that an individual is sick.
It's unfair to leave your officers as the government stuck in one job group for the last 15 years. That's unfortunate.
Very unfortunate.
The union issued a strike notice on the 30th of December last year over failure by the government to address their grievances. The push and pull between medics and the government, according to ODM leader Raila Odinga, is shocking at a time when the country just released thousands of learners to schools and when the world is carefully watching the developments around COVID-19. The former premier in his statement said, quote, "This is a time we need all the healthcare workers on duty or on standby, not on strike or being tossed around between the two levels of government." End of quote.